Knee pain can be a sign of a serious injury, or it could just be a minor issue that you can treat at home. Either way, it's important to know how long you should wait before seeking medical attention. In this video, we're going to talk about that. I'm Dr. David Geier, orthopedic surgeon, sports medicine specialist, and anti-aging and regenerative medicine expert. I help you feel, look, and perform your best regardless of age or injury. If you suffer a knee injury or you develop knee pain even though you don't remember a specific event that caused it, it's important to know when you should see a doctor or orthopedic surgeon. Now, there's always exceptions, but my general rule is if your knee pain lasts for more than 1 to 2 weeks and the symptoms aren't getting better over that period of time, it's possible there's something more serious going on, or at least something that needs more than just rest, ice, and anti-inflammatory medications. But more than just time, it's important to look for specific signs and symptoms. So let's talk about those. First would be swelling. A little bit of swelling, maybe not such a big deal, but a large amount of swelling within the knee is usually a sign that something's going on. It might not be orthopedic, it could be a medical condition like gout, but significant swelling is not normal and should be checked out, especially something like an ACL tear. The knee swells really a large amount of swelling, and it's important to get that checked out. If you notice a loss of range of motion in the knee, you can't get the knee all the way flat, especially, that's usually a sign of something going on. Or maybe you can't bend the knee all the way. That can be a sign of something blocking your motion or a process in the knee like a ligament tear that could be causing that symptom, not getting your knee all the way flat or not being able to bend it. Maybe it's pain when you bend your knee or pain when straightening the knee. That can be a sign of something like a meniscus tear or something else like that. That's an important thing, especially if you feel like it's catching on something and then you're able to get the knee past that. That's something, again, like a meniscus tear that would be important to go get evaluated. You want to see if you're having buckling or giving way of the knee. That can definitely be a sign that something's going on, like a ligament tear, such as an ACL tear. Inability to bend or straighten the knee at all, meaning it's getting stuck in a certain position. Typically, you see that in maybe preteens and teenagers with what's called a bucket handle meniscus tear, where literally the knee is locked in a certain condition. That almost always needs surgery, not just to get the knee bending again, but to repair that meniscus. And then pain with weight bearing or walking on that knee. All of those can be signs of injuries like ACL tears, MCL tears, fractures, and meniscus tears. In these cases, it can be a good idea to see an orthopedic surgeon to get x-rays and maybe an MRI to determine what the injury is, the extent of the injury, and determine the appropriate next steps, whether that's a brace or physical therapy or even surgery. I'd love to hear your experience with your knee injury. Leave those in the comments below. I do read those, but just understand I can't offer specific medical advice online, so I rarely respond to those comments, but I do try to answer those questions in future videos like this. These come from comments left in prior videos. Also, make sure to subscribe to my channel. Click the bell to be notified when I release a new video and when I start another live stream, including the almost weekly Ask Dr. Geier live shows. Thank you so much for watching. I look forward to helping you feel, look, and perform better than ever.